Okay, good evening, everybody. How are you? It is starting to get a little nicer weather here in Texas. Still a little bit warm here, so just wanted to welcome you to weekly Facebook Live that then is uploaded to our YouTube podcast for healthcare hot topics and hot topics in healthcare. And I really have a passion about bringing these topics weekly. There are so many different topics in healthcare, especially with being in nursing for more than 20 years. There's a lot of information, even today, I wish I would have known. When I first started out, and even there's nurses that I work with on a daily basis, where to me, sometimes I just think the information is public knowledge, and then they're like, might say something like, oh, I didn't know that, and I never treat them like they're dumb or don't know. And to me, sometimes it's surprising of like, oh, wow, they didn't know that. And then I realized, that they either could have been forgotten. Maybe somebody told them they forgot, or maybe they were never taught. So I don't want to ever assume that somebody knows something that they don't know, especially in healthcare, especially in nursing. However, my disclaimer is with this. When you work in healthcare, many times when you take a job in healthcare or any type of setting, many times you are signing a job description. And along the job descriptions, you're going to see, other duties assigned. So in that interview process, or even before you sign that job description, I'd say before you sign that job description, when you get that job offer, you want clarification of that, of what specifically do they mean as other, job duties assigned, defined that can be assigned to you. Because if you just blanketly assign that, what are they wanting you to do? Within healthcare, it would have to be something that's what's considered within your scope of practice. Meaning if somebody's a nurse's assistant, a patient care tech, they wouldn't be allowed to give injections or medications to somebody unless maybe they were in a nurse residency type program or nurse like internship, externship program. But for a regular person on the job, those would be outside of the job, their scope of practice. I remember one time years ago, I was working at a nursing home, and we had a social worker, and I love my social worker friends, love them. This one social worker was bringing in her dog. No, this was not a therapy dog that was trained. This was not a trained therapy dog. This was not an emotional support animal. So she was bringing her dog to work, and she would call it a therapy dog. It was not a service dog, not a service animal, any way, shape, or form. And she thought then it was other staff, including nurses, including tax duties, to clean up that dog's, poop in, the courtyard. And we're like, no, this is your dog that you brought to work. Yes. Is it making the residents happy? And she's like, well, it's a therapy dog. We're like, okay, well, show us, the papers. And she's like, well, it's making people happy. You guys scoop the litter of, the cat. And it's like, well, yeah, but we don't have to do that. That is something we are doing for the residents. And at the time I didn't have any pets, and they're like, well, you guys would do this because you have pets at home. I'm like, nope, I don't have any pets at home, and this is a reason I choose not to, so I don't have to clean up after them. And so we're like, this is not, and she tried to argue that was one of those things as other job duties as assigned. And we're like, no, this is your animal. You need to care for it. This is a part of having an animal. So she was not happy about that. But, she eventually, was cleaning how to, clean up after her own animal that she was bringing to work. And I say that is because sometimes people sign job descriptions and don't know what's in there. So when you're signing a job description, one, make sure you get a copy, because you want a copy also if you leave that job, that when you do your resume, that you have the indicators of what was a part of your job. So there's that. And so then you kind of have proof, like, this is what my job expectations were. This is what I did. And then also when it comes to evaluation time, you can look at that to see, did I do that? Did I exceed that? And so that's one way to have that. Other tools you want to have is also making sure that you always have the phone numbers to IT stored on your phone. So many times if you come into work and your computer's not working, you're going to need to call IT. And if the number stored, your list of people to call is stored on your computer, you're not going to be able to call IT. So also making sure you have HR's number for those same reasons. Also making sure you have numbers to employee health. If there's a certain number that you need to call if you're out sick, if there's like a different number, if it's working in the hospital, if you need to call the house supervisor, of knowing, for example, what the call-off policy is, make sure that you know that and that you have that phone number on hand, and that you know what the policy is. Is your policy, if you're truly sick, have the flu or something like that, or something that's super contagious where you're not supposed to go into the hospital, something like shingles, mono, strep throat, what is the policy about that? So you want to make sure you know those policies. Also, who do you call? Is it the house supervisor? Is the manager? Who do you call off to if there's a family emergency? Which, I know a lot of my friends work in healthcare, they don't call off, but sometimes there are family emergencies. Sometimes their child may be, super sick with something, throat, something, maybe the kid had to go to the ER because, they fell, broke a bone, any of those type of issues. That life happens. We can't control everything. As much as nurses, we do try and control a lot. Yeah. So there's that. So no matter where you work, make sure you have those numbers on hand, store them in your cell phone, even have your manager's number stored just in case. For me, it's kind of easy because HR is my manager. The HR VP is my manager. So some of these policies I really need to know. I do have IT's phone on both my work phone and cell phone, my personal cell phone, same with our house supervisors, which is really great for me. That's helped a lot, especially for me doing presentations. The first couple of presentations I did, computer did not like me at all. So I was like, hey, how do I do this? And sometimes, of course, it was the most simplest thing that I was completely doing wrong. So learn from that. And the other day, we got kicked out of the one room that I like that computer set up a little bit more because it's more user friendly. So always make friends with your IT people, the EVS janitor staff, absolutely. Those are like my best friends. The facilities people, those are like the best people to know in the hospital. And anywhere you work, because if I need anything, I can just like reach out to them, and they are so kind, so helpful to me. And other days doing a presentation, like it wasn't working, and I was just like, I'm just going to wing it and send everybody my slide deck later on. I know this presentation, I'll just send it later on, so it works. So I've had a few people that I work with lately where they haven't known the policies and procedures. And this has sometimes caused issues because they thought they knew them. And then say, if they don't know them and they're telling somebody else, like say, they're precepting a new person on their units, and they're giving them maybe the wrong information and not knowing that, well, that person is still responsible for knowing that information because they signed it, saying that they knew what those policies and procedures were, that they signed knowing like, hey, I know my job description. I know the policy when I call in sick. I know the social media policy. I know X, Y, and Z. And so that brings me also to other issues is also when, no matter where you work, especially when you're working in healthcare, and I will say for more public jobs, sometimes if you're working, teachers, also, I'm just going to say lower levels of government, like I'm talking like city council, like board members, superintendents, they have to be very careful about their social media, or they're supposed to. I'm not saying that they can't have TikTok. I am not saying that they cannot have fun. I am not saying that at all. But you do want to be careful about what you post, of putting like what school you work at on there. If you're bad mouthing other, teachers, your principal, I work at a hospital. I'm very careful not to go and publicly badmouth, the hospital I work for, my coworkers, the other nurses, the other staff, my boss. Now, do I always agree with every decision that is made? No, because I work in healthcare, and we know healthcare is completely broken. And I want to be a part of the solution and have a seat at the table and bring ideas, and I'm not saying all my ideas are the best. I am not saying they are all the greatest. However, I am at least bringing something to the table. I am bringing ideas. I am bringing something. And they can say like, oh, this won't work. And I'll be like, okay, well, why won't it work? And they might give me a valid reason. And then other times they're like, oh, well, hey, maybe that will work. Because I might have been like, well, have we thought about this? And sometimes it's that fresh perspective, a fresh set of eyes on a problem. And they're like, oh, and then I might be like, oh, that was simple. Why didn't somebody else think about that? And people can think about that of issues that I have. They're sitting there thinking like, oh my gosh, why didn't she think of this? This is the easiest solution ever. And it's because maybe I just haven't thought about that. Maybe my brain just doesn't work like that. Or maybe I had thought about it and there was a missing piece, or maybe I didn't understand the process, or maybe at that time I didn't have all the information, or didn't have the finances, or like I said, something was missing. But it is still people's responsibility, like I said, to know their job description, to know what to do if they're sick, if they need to call off, because if you just don't show up to your job and no call, no show, you're going to be terminated. You just can't be like, I didn't know who I was supposed to call, so I just didn't do anything and I didn't show up. That's not a reasonable answer. That's not like a reasonable defense. Like, I didn't know was not like a very reasonable defense for anything really. You know, like if you're speeding somewhere and, you know, you get pulled over and they're like, you know, oh, I didn't know the speed limit. You can be like, well, why did you pull over? And they're like, where you're speeding. And you're like, oh, I didn't know the speed limit. That really doesn't usually work as much as a defense. So like I said, when it comes to your job description, make sure you keep a copy just so you know that the important policies such as dress code for healthcare workers, a lot of it is you have to be careful about the type of jewelry you wear. Can't wear like dangling earrings. Some hospitals, depending where you wear, are a little bit more strict with having natural color hair. Some, you know, I do know because in healthcare, a lot also even you have to be careful because of people's allergies and migraines of wearing perfume or cologne after shave. Some, you know, you don't want, like I said, wearing dangling earrings because patients can pull them. It's also an infection control issue. Also having, you know, like necklaces, that can also be an infection control safety issue. Wearing rings, again, infection control issue. So some will let you wear a wedding band. Also, fingernails. A lot of them, you can't have nails that are longer than a certain length. Most you cannot have tips or acrylic nails or any type of fake nails. You can have like freshly polished nails. You can't have any type of overlays. You can have like gel and I think dip, but even some places are not even allowing that. So make sure you know what the policy is on that. The fact like you don't know does not apply. Also for healthcare, a lot of times for the shoes, they have to be all leather. They cannot be Crocs. They have to be closed-toed. Also for men, because of the mask fit for if you're taking care of people with tuberculosis, you have to make sure that N95 mask fits. So depending on facial hair, there are policies for that. So making sure like you know what you are signing, that you make sure you know what to do if you have an injury, if you know what the workers' comp is, if you know what to do or who to notify if you need short-term disability, if you need to go on maternity leave or paternity leave. Does your company even offer that benefit? If you need to apply for FMLA, if you need to apply for any type of accommodations, do you know what that process is? Because a lot of people, unfortunately, don't. Even some managers that I worked with, we realized like, oh, that they themselves didn't know the process. So we do a lot of education around that. Even, you know, do you know what, you know, the new hire sign? Do you know that process of everything that goes into an appointment? So a lot of it is lots of education. Also, this time of year, a lot of people are getting in the mail within the next couple weeks. If you have, you know, a 9-to-5 job where you're not a entrepreneur, if you have a W-2, or your partner or spouse does, you're gonna, majority of people are gonna be getting what they call their enrollment information. And what that is the yearly information about your benefits package, of your insurance. You know, is your insurance changing? When do you have to enroll by? When do you have to have the beneficiary information? Usually if That's if you have kids, you know, having their social security numbers and birth dates if something were to happen to you, that dependent information for life insurance if your company offers that. If you want to change your insurance, this is the time to do that. Also, you want to look at, you know, your flex spending account and health savings account. How much did you use last year? What's a good amount for the monthly that's pre-taxed? Really see how much you used for child care, you know, for elder care, for, you know, dependent care, what, you know, were medication costs, for dentists, for prescriptions, for chiropractors, all of that, you know, glasses, contacts, where you can look at that and see what you spent last year, so you know kind of what to put this year, so it's pre-taxed, and some of it depending what plan you go with. If you don't use it, you lose it, unfortunately. So make sure you're looking at the fine print. Some of them give you till the end of March. Some of them it's end of January. Some it's actually would be end of December. So just make sure, one, you know the benefits, that you look at the cost, because you're going to be given a lot of information. So you want to look at, well, can I keep my doctor? Can I keep the doctor that I've been seeing? Or do I have to get a new one? Is this doctor going to be in network? Is the hospital going to be in network? Is the hospital I work at going to be in network? Is that ER going to be in network? Where can I get labs done? Is the lab closest to me? You know, is the urgent care down the street the one that's closest? Is that a network? Is the hospital that's closest to me in network? Is the ER that's closest to me in network? Are, you know, my eye doctor, dentist, even if you're seeing a therapist or psychiatrist, are those doctors and providers still in network? Now, when it does come to specialists, sometimes such as psychiatrists and therapists, you can do what they call a continuity of care, continuation of care. So you might you might have to get a prior authorization for that and fight for that, because it could be denied, but you can get it appealed on, hey, I have a good rapport with this person. I've been seeing them for this many years, and it would be detrimental to my care. So make sure you know your rights with that. Make sure you know your rights when it comes, if you need, with the new benefits coming, some of the medications you've been on, you may need a prior authorization, where last year you didn't need a prior authorization and now you do. So you want to look over those benefits, especially with the medication part, so then you're not waiting and going without your medications, because we won't want that to happen. We won't want you to get sick. However, if that does happen, some pharmacies will give like a 3 to 7 day supply, depending on the cost, depending on the medication. It is usually not narcotics or any controlled substances. Usually it is sometimes like anywhere from a 3 to 7 day supply for the authorization to go through. There are programs such as GoodRx. If you're having issues with your benefits, if it's taking too long to get that authorization, that's just another way to go around while you're waiting for that authorization to go through. I think it's Single Care, GoodRx. Another way sometimes to get medication paid for during that process, if your insurance company isn't going to pay for a medication, or you're waiting for the authorization to go through, is going to the manufacturer site on the internet, to their website, and actually getting a savings card or a prescription savings card and filling out the information, and they will like email you the card or even text it to your phone. So it's really nice. I just use that on one of my medications that my insurance unfortunately like no longer pays for, and so I have to pay for it out of pocket. And so the savings card is nice. I know I've used it, one of the other savings cards, and it saved me a lot of money. I think for a while it was like $10 to get the medication. Then my copay was like $30, and without insurance it would have been $900 to like $1,000 for like, honestly, I think like 15 pills for my migraine medication. And I was like, I kind of thought that was dumb, because I was like, these migraine meds like keep me out of the hospital, keep me out of the emergency room. So you're saving money by giving me this medication versus not paying for it. So that's just some of the absurdities with our healthcare system. So I just want to, hop on here and, let you know what to do, for, to get your medications if you're having issues with your insurance company. And you can always file an appeal. Just make sure you're following the process to the T. You can't miss any steps. With that, you have to do it within a certain amount of time. And also that's also if they were to deny like any type of procedure, you can always deny it. If it gets denied with the insurance company, you can always appeal it, and make sure you're talking to your provider about that, because sometimes if your medication's denied or needs a prior authorization, sometimes the pharmacy is not communicating with that. So when you're going to, call the pharmacy, hey, is my medication ready? And they'll be like, oh, we need a prior authorization. Make sure you are also communicating with your physician. And then ask them, like, say, hey, I need a prior auth. Is there, another medication that might be better? And let the physician know, what insurance company you have. And even call your pharmacy benefit and ask them, say, is there something else that would be covered? And you can say like, oh, I've tried that. And then let your doctor know like, hey, I've already tried these medications. This is what they're telling me. So then the physician knows, how to write that appeal letter for you, because I know physicians are like nurses, they're overwhelmed. They're seeing a lot of patients. They're doing their best they can. And all the rules for the insurance companies, the physicians are doing the best they can. The rules for every insurance company is different. This insurance company will pay for this medication. This insurance company over here won't. This insurance company will pay for this. This insurance company pays for this, but this one only pays for this and that. So there's so many different insurance companies, and there's so many also different tiers of insurance companies with co-pays for the office visits, for the specialist. Also for, there's even different tiers for the medications of what your co-pays will be, what you'll be paying out of pocket for both visits and for your medications. So it's a lot. And, the physicians cannot remember all that. They're trying to do the best they can and give everybody the best care. And every year the insurance company is changing what they will pay for and what they won't. So just make sure that you are looking over these benefit packages as they come, as open enrollment is coming within the next few weeks. You'll be getting that information. Now, sometimes it's mailed to your home. Sometimes it is emailed. So make sure if, your spouse or partner is the one that has the benefits in their name, that you are checking with them about any and all changes make sure, that if that's the person, that they are staying on top of it. Because also when it comes to the enrollment time, what they call open enrollment, you have to enroll by a certain date. If you don't enroll by a certain date, they do one of two things. They keep your plan the same as it was the year before, or you do not, or they don't have to give you insurance, and they're like, too bad, so sad, you did not sign up in the allotted time. And then the only way you can get the insurance if there's some type of life-changing event. And that is like if you get married, have a child, or if you're married and, your spouse were to unexpectedly pass away, or if you adopt a child, or unfortunately, if a dependent passes away. Those are really the only ways to really get around that. So not knowing like, oh, I didn't know I had to sign up by this date. They don't really give any grace, because think of the insurance company as they want a reason not to pay. So just make sure that you're looking at those dates, that you're really reading what the benefits are, and also know what benefits you're entitled to when it comes to short-term disability, when it comes to things like workers' comp, when it comes to FMLA. Does your, what's the short-term disability? Do you, is it 60%? Is it 80%? How long do you have to work there? Some places it's 6 months. And just like for PTO, some places you start accruing PTO from day one. Other places it's after 90 days. Some places you can't use PTO till after 90 days. Others it's 6 months. But you start accruing after 90 days. So make sure you know like how much PTO you're accruing. Do you get holiday pay? What holidays do you get off? Make sure you know that information. Do you get double time? What is the overtime policy? Make sure you know that information. What's the paternity leave? What's the maternity leave? Do they have that? How long do you have to work there to qualify? Like it says, short-term disability, some people, 60%, some people you get 80%, some, it's 60%, but you still have to pay your portion of the insurance, and some you have to be there for 6 months. Some it's 6 months, but most places you have to be there a year to then qualify for FMLA. So a lot of it is very employer dependent. It's going to be depending on the employer, because they can say, FMLA says you have to be here for a year. So just make sure you really know the benefits, what your, policy is for accommodation, workers' comp, disability, all that good stuff. And, make sure that you're aware as these change, because sometimes yearly they change, and the policies will just be sometimes emailed, and sometimes you're just signing off that you knew the policy, and sometimes you can forget it, but you're still required to know that policy. And also for those, working as healthcare and, teachers, you have to be careful too of like what you post on, social media, all that great stuff. I know there have been some nurses a while back that they were posting that certain things gave them the ick, and they ended up getting fired. So I'm all for having fun, but just be careful of not putting any type of protected health information that could identify somebody out there. Like, I'm careful because even wearing like my scrubs actually say the corporate name of the hospital on them. I don't think they say the actual location, but I do think it has like the regional area of the hospital I work at. But it doesn't say, because there's like a lot of different hospitals under that particular hospital system. And so even with that, I'm careful, like when there's pictures in my scrubs, I try not to have like my badge. I try not to, have it where it shows the logo. Just those things, one, to protect myself, protect my job, protect where I work, those type of things. So, and, keep my privacy. And so then I can't be accused of, oh, well, she said something about so-and-so. And it's like, no. So you have to be careful too with what you're posting on social media, especially in healthcare and certain professions, because you're held, to a higher standard. And also workplaces do have social media policies about that type of stuff, about, cyberbullying, about saying, bad things about the company, bad things about, coworkers, but also having, making sure you're not saying anything identifiable about like students, patients, any of that type of stuff. So just be careful with that. And, make sure you all are staying safe out there as it is flu season. Make sure you are washing your hands. Make sure, because that is the number one way to prevent infection, to make sure you're washing their hands. Also, little ones, make sure they're washing their hands. And also, if like you're in healthcare too, something I do and have always done is my work shoes. I always leave by the front door, so I'm not tracking. Like even when I go to the grocery store and stuff, and worked in a hospital, so I'm not tracking nasty stuff all over the house. My work shoes, I just leave at the front door. I know a lot of people started doing that in COVID. I did it way before that, because you just never know what you're checking in, especially when you have like little ones crawling around, all that kind of stuff. So just stay safe and healthy out there, and I'll see you guys all next week.